Hello, I'm Ian Scales, you're watching TelecomTV, and we're here at the Internet of Healthcare event in London. I'm going to be talking to Ashfaq Gilkar, who is a senior clinical analyst at Guy's and St Thomas Hospital Foundation Trust. Gilkar, welcome to TelecomTV and thanks for coming along.
No problem.
We want to talk about your passion, which I understand is remote devices, really. Remote devices and ambulances. Let's cut straight to the chase.
Sure.
Tell us a little bit about
Of course.
how you see that developing and what the future might hold for that.
Sure. If I can just give you a background to the actual project.
Yep.
Our current project is basically to obtain pathology test results electronically within a hospital setting from an ambulance. So this was basically an offshoot of a project that we conducted in 2012. It was an NHS London fund project, and it was to basically ascertain whether POCT devices within a A&E environment can aid in reducing congestion and reducing patient waiting times.
What's a POTC? You have to explain some of
POCT,
these
sorry.
acronyms for
POCT is a point of care testing
Okay.
device.
Okay.
So it's basically a pathology device or any other device for diagnostic measure at the patient bedside.
Okay.
And so this particular project, which I've spoken about in this conference, is basically about utilising a number of point-of-care testing devices within that ambulance setting, and to get the result, the vital, essential, life-saving results from the ambulance setting to the local hospital. And in this case, the local hospital was Guy's and St Thomas's. We're currently just doing a feasibility or a pilot study to ascertain whether the devices are usable and user-friendly for the advanced paramedics. It will then go on to further phases where we will instigate the connectivity, which is where the Internet of Healthcare comes in,
Yes.
in terms of the connectivity of those devices to the hospital.
Okay. So explain a little bit more about the devices then and what they do.
Sure. Well, the devices that we've chosen for this particular study, this feasibility study, are the iStat, Abbott iStat, and the HemoQ radiometer. Now, they perform serum UNEs, urine electrolytes, creatinine, lactate, etc. And the HemoQ performs a white blood cell count.
You might just have to turn that into English for us.
Sorry. What they perform is the essential blood test that you require to diagnose cardiac arrhythmias, cardiac cases, and sepsis,
Okay.
which are some of the main serious cases within an ambulance setting. Now, there's also drug toxicology, which we could also apply an analyzer for, but that's not currently conducted within this feasibility phase. It's something called the ALIA biosite triage, and it does a full drug toxicology screen. So if you've got, say, an overdose case,
Yeah.
you could diagnose that rapidly within that ambulance setting.
Right.
So it's all about life-saving interventions for diagnosis within an ambulance.
And the key is that you're able to distribute that expertise out to the ambulances via the existing paramedical people that look after the ambulances and rush you to hospital.
Correct, and the users are all important in this, and
Yes.
the advanced paramedics are going to be utilised for the first phase of this. It will eventually be rolled out to all the paramedics,
Yes.
but the advanced paramedics are the ones who have been trained in utilising point-of-care testing devices, and training is all important in this. And also the quality control aspects, so they're fully au fait with that aspect of things. So initially, the first phase will involve advanced paramedics.
Now, it strikes me that as well as that highly specialised medical equipment that you're talking about distributing to the ambulances, a lot of the technology that we already have, for instance, high-end smartphones with their cameras and
Yes.
all of their different capabilities,
Yes.
could also be used in this instance, where you could have
Absolutely.
a remote surgeon, say, looking at
Yes.
a terrible accident via the telephone and instructing the paramedic.
Absolutely.
Do you see that happening?
Oh, I can see as well as pathology analyzers, I can see physiological measurement devices, and even those things like ECG machines or other types of devices being connected, and via telemedicine even relaying that information to clinicians within the local hospital.
Right.
So it's something that is exciting, and it's something for the future that we could pursue.
Right. So once you've got the kind of core system established,
Yes.
and the processes that the paramedical people have to go through
Yes.
to actually use those,
Sure.
you can see that being extended to other types of application, can't you?
I can, yes.
What sort of IoT devices might you use?
I think that I was reviewing the Google spectacles or the visual aids.
Yes,
and
Google
I think
Glass.
that would be fantastic perhaps for capturing an image of test results or say an ECG scan and transmitting that data in an image format
Right.
to a clinician within, say, a busy A&E department,
Right.
where they could assess, diagnose that patient even before the patient turns up to
Yes,
the A&E
yes.
department. So I can see that being very, very useful.
Presumably the guy in the ambulance, the paramedic in the ambulance, could also be wearing Google Glass,
Yes.
get a heads-up display of how to
Absolutely.
do something.
Yep. And equally, from the hospital to the ambulance,
Yeah.
that the clinician in the hospital could advise the paramedic as to next steps via the Google visual aid.
How tooled up are all the ambulances? Because I would have thought the next step is to get them all LTE enabled and then 5G enabled, so they can do all of this stuff with high bandwidth services.
Surprisingly, a lot of ambulances are pretty much they have connectivity there. There's something called the EPRF form, which is an electronic version of the vital statistics and vital observations for that patient, which can be electronically relayed back to the local hospital.
Right.
That's already in place in a lot of trusts. And I think that in terms of connectivity, there's data connectivity is possible.
Yes.
It's not fully utilised in every ambulance service, but the potential is there.
Right.
Yeah.
And as you're talking, I'm thinking, well, the way this is going to happen is in dribs and drabs through trusts. There's going to be no national scheme. There's going to be different trusts, and maybe that's a good thing. You can try out different things and see which works.
Absolutely. And there are one or two trusts that, although albeit very few, that are actually pursuing the ambulance diagnostic route.
And this is something you're going to stay on top of and keep pushing for?
Absolutely. Something that, as I said, I was passionate about. And
Yes.
if it's a life-saving venture, then it's something that's a noble cause.
That's great. Well, good luck with that.
Thank you.
And thank you very much for coming and talking to us.
Thank you. Thanks.